Smile evening to each one of you for this wonderful session from our Guruma Bhupinder Mam, International Sujok Trainer, and jointly presented by Joshi's Kerala Group. This backache session is very important because uh, generally everyone gets backache. For some, they don't need any, treatment. By next day morning, when they sleep off and get back to, new day, it is gone. But for some, back pain is not like that. It is like sometimes it is daily, it's available for them. It's just like a routine for them. And for few, it's there today, tomorrow it's not there again. 2 3 days back, it's again back. So it's irritating pain, or it is creating problem in the lifestyle or in your daily routine. So that's what ma'am has taken this topic back pain, because this back pain will also, this treatment will also help in the regular general pains which you have. It might be relieving that pain forever. And also for those which you have, continuous pain or breakup pains or weekly pains. So this will be answering all those queries. So I request you all to please sit on with your books, pens, and your open mind for this wonderful session. And I'm starting this session by sending all your gratitude to Bhupinder ma'am for this wonderful and grateful session. Smile evening, ma'am. A warm welcome to this session from Joshi's Kerala Group. Please take over the session, ma'am. Thank you.
Smile evening to everyone. Thank you so much for your presence. Yes, today's session is really special because spine, when we talk about back pain, it is not just back pain because this spine is related to, spine is part of nervous system. You all know this, yes? And in level one, we have learned five-step treatment. Yes, and there we are giving special attention to spine point in all diseases. Let it be liver disease, lung disease, heart disease. Yes, spine is very important because the nerves with this spine vertebra, it is connected to some of the other organs. So we should not neglect our backache, let it be cervical or tailbone pain, lumbar pain, thoracic pain. Most of the time, people are facing lumbar pain, yes. And there are many reasons actually. Today, we will try to explore those reasons and then how we can take care. And I really want you to take action if you are having spine pain. Please, even if you have not done sujo any level, it's okay, it's fine. Yes, because just whatever points I will show you, you just follow it. Just follow it and do it. And I'm sure that you will see the result. If spine disease is chronic, if it is old, then you have to do it for a few days continuously. Yes. And if it is just temporary problem, then just maybe one sitting is enough. So let us talk now. I'll share my presentation. Just a moment. I'll try to make today's class very simple so that you can bring in your practice. You can take action. This is my purpose. So, lumbar pain, spine pain, back pain. Yes, back pain. There are actually several reasons. And especially I'm talking about that kind of pain which is stubborn, chronic, which come back again and again. Yes, not leaving, not going. And why this pain becomes chronic or stubborn? Yes. So one of the reason is that uh, poor posture. We don't pay attention to our posture. For example, now you're sitting. Yes, just look how you're sitting now. Yes, in front of your mobile or laptop screen. What is your spine posture now? Our rishis and yogis, they used to make sure that when they sit straight. But it is not strict strictness, erect spine, but straight spine, but with gentle energy. One is very stiffness, strict, straight. This gives pain. Yes, only thing is that when you are not in habit, when you don't sit straight in your routine life, then sitting straight is painful for you. But if it becomes habit, and whenever you sit or stand, your spine is straight, it is your habit, then standing straight or sitting straight is effortlessly, this is effortless posture automatically taken. Yes, and then you don't feel tired, you don't feel pain. But if you don't have habit of sitting straight or standing straight, then after a few moments you will return back to your original posture, that is not correct posture, because sitting straight gives you discomfort. Your muscles are trained in such a manner. First, we have to check like this. We have trained our muscles in such a manner that now we enjoy with our curved spine. Yes, our sleeping postures. When we sit, we are just tilting. We have started enjoying, and then our muscles are trained to, sit like this. That is why we enjoy. But later, in long run, it can become a disease. Yes. So this is one of the reason, poor posture or long sitting. Sometimes you have work like these days in office. Yes. Sometimes you have this kind of office work where you need to sit for a long time, long sitting, and that this is also not good because you need energy flow in your area. Energy movement is symbol of life. Yes, energy should move. So I'm not saying that you don't pay attention to your job because your job is like this. But at least after an hour or after half an hour or 1 hour, you should stand, you should move. Yes, little bit, create some kind of movement, some vibration in your body. Yes, allow your energy to move. This is very important, whether it is cervical or lumbar. Then from today, you start checking your postures. As I told you that some people are enjoying their wrong habits because their muscles have got this kind of training. How you sleep, just try to check, because during sleeping, if you uh, make wrong posture, then whole night, can you imagine, whole night you're sleeping with wrong posture. Initially body enjoys that posture, yes, curved and folded legs and folded, your spine is deeply bent like this, so initially it gives you good relaxation. But if this becomes a habit, then it is going to create a problem in near future. Overuse of spine. Sometimes, like when we go to gym, when we do exercise, we feel very good. Oh, I did this much. Yes, workout, exercises. Yes. But then overuse is not good. This is not good. We need to work in harmony. But then I don't say like labor class, they have to work. Yes, but then their spines are trained, their muscles are trained. Yes, from the very beginning, they have trained their muscles in a very good way, and their postures are also good like this. But if you're not habitual and then you do and you overuse, then this is going to create a problem. Heavy lifting, yes, and you're not habitual. This will create a problem. Actually, it is a technique also. When you are lifting, you see, how labor class, when they are lifting up, they have a technique. Yes. And sudden movement. When you get up from the bed, suddenly you get up, uh, door, door bell rings and you get up quickly. This is also not good. Yes, each posture of your body is creating a certain kind of energy. Please understand this. Yes. So, what kind of energy you are creating? In that present moment, you will not understand and you will not experience the side effect, but in long run, this will give side effects. So, poor postures, yes, and long sitting, wrong sleeping position. So, all this can affect your muscles, your ligament, and then in near future it can lead to stiffness, spasm, and fixed pain. Then another reason is disc problem, slip disc herniation. Yes, so this is also very common. You can see this picture when there is a slip disc, this gray color in this picture. You see this gray color. This is protruded. You see projection. You can see. So here disc bulge. This is like when disc bulge is there or or rupture is there, it presses the nearby nerve. You can see this is nerves, yellow color. These are nerves here. And when this disc comes out, yes, it is beautifully fixed between the vertebrae. Yes, to give the flexibility. But when this disc bulges, it comes out and it leaves its location and comes out. And naturally, when it will come out, it will press the nerve. Nerve compression will take place. And then this can create, when nerve is pressed, automatically numbness will come. When nerve, that's the part, that part, because nerves are connected to other parts also, legs also. Sometimes you see sciatica pain because this nerve is compressed. So it will create pain, numbness, tingling pain, like in sciatica you feel. Okay. So it loses this, it in this situation, this disc loses its moisture, warmth, and vitality. So exercise is very important in this. You need to do under the guidance. But if you start your exercise, it will really help. Like you can see this picture lying on the stomach, belly, then slowly pushing upper body up, keeping hips down, and 8 to 10 steps, 2, 3 times a day. Gently, you have to do. This will help uh, it will push the disc back into place. So it is very important because you see, when we talk about this, it is rejuvenated only with the movement of energy and movement of ligament and muscles. Direct nutrition, it will not get. If your food cannot give direct nutrition to this disc. It should move. Movement is very important. That is why, when people have pains, knee pain or back pain, they stop their movements. Yes. Elbow, shoulder pain, frozen shoulder. Yes. In that time, they stop, they don't like to move, they stop their movement. But in long run, if they don't maintain their movement, then it will become chronic and this place will not receive uh, hydration and oxygen and no movement, no light, no energy, and degeneration will take place. So please understand that if you're facing this situation, then under the guidance of like physiotherapist or under the guidance of doctor. One time you need to understand your exercise, and then you have to do. Initially, you can start with your doctor, and then you can do it on your own. But it is very important to do gentle exercises. You have to create movement. Stiffness, if you're feeling stiff and you are on the bed and you don't move, then this stiffness will become very serious. It is like, then it will be difficult to move also. We need to correct our posture every time, actually, in all classes. I say it is not just lumbar pain or spine pain. Posture, how you talk, how you walk, yes, what kind of posture you are holding in present moment will decide your energy flow, what kind of energy flow. Yes. Now you see good posture, this is straight body. Yes. And then your prana flows very nicely. Your chakras are connected to your central line, your core and internal central line. We have chakras, and also our solar plexus, and we have nerve centers, very strong energy pools are there. In the central line, we have several nerve center where many nerves, delicate part of nerves uh, are in bunch form, and it is uh, in the place of chakra, you can imagine. Actually, physically we don't see the shape of chakra with our medical equipment, but there are nerves, very plexus are there. Yes, that is not chakra, but very strong energy is there. So if our posture is not good, yes, then there is interruption in this energy flow, interruption in the core meridian. In core meridians, energies are flowing. In chakras, energies are flowing. And when energy flow is interrupted, yes, this is metaphysical world. We are focusing physical and metaphysical both. Yes, when physically disturbed, then also it will create problem. But metaphysically disturbed, then more problem. Yes, and then slowly, when pranas are not moving, in it's in prana should move in a line organized by the divine. Creator has organized very beautiful system inside our body. When we study zone energy system, you all know, some people, they have done zone sujoki, they know that we have a very beautiful system, energy flowing in in vertical level, in horizontal level, and in spiral level. And professor used to say that if you organize your vertical energy system also, automatically your horizontal and spirals are organized. Yes. But you see this poor posture man, yes, and very in early age we become like this. Poor posture, right side and left side. In words, but then we don't maintain our posture all the time. Initially, you have to do practice because your muscles are not ready for it. Yes, you will get tired when you do good posture. Your body will not accept your good posture because not used to this good posture. Yes, so you'll become tired. Doesn't matter. You do it again. Yes, and then you do it again and again and again. Yes, so if you are suffering from spine pain, really, I would like to recommend that you make one symbol for you. Yes, for example, write somewhere so that you can see, or keep some thing, some item in your room, so that when you see that item, you know that you have to check your posture. Or you wear one bracelet. Yes, every time you see bracelet, I have to correct my posture, whether sitting or standing. When you start correcting your posture, not only your spine is improving, but many things are improving. Your correct posture of spine is also connected to spiritual world. Yes, your Sahasrara chakra is on the top of this line. It is connected to where is your Sahasrara? This is when you see the center person exactly on the top center point. And when you do wrong posture, your Sahasrara, you're disconnected with the top crown chakra like this. So, you when you start doing this, start working on your posture, you will see many changes in your life, not on the level of spine, but your body level, organ level, yes, mind level, emotion level. Okay, so don't take it uh, just simply. It is a very big change if you can correct your posture. Now, this is degenerative condition, degenerative disc disease. You can see there is a mark here, inflamed red color here, degenerated disc. This you can see here. And uh, so this actually, as I told you, that this disc does not get nutrition. Yes, degenerated disc means it has lost that. It is losing water. This is dehydration condition of disc. In 6 key, we can say dryness energy. It becomes because no liquid, no water inside. Yes, it becomes dry, becomes dehydrated, and it becomes thin and weak. Yes. So the space between vertebra reduces. You can see the space is reduced, and slowly it will affect the nerve. When this space is reduced, then nerve will get compressed. So disc has no direct blood supply. Nutrition can come from movement, that I have told you. Yes, movement is important. You have to drink enough water, gentle spinal movement, walking daily. Start with gentle walk, but don't stop walking. Movement is symbol of life, and in this case also, movement is like pump effect. Initially, you may get pain, yes, but slowly, you will find a change, yes. But don't do harsh push, because this is also not good. If you are not walking these days because of your back pain, because of your disc problem, if you're not walking, don't start in a harsh way. Gently, you have to start. Naturally, nerve compression. Yes, you can see, and when there is herniated disc, it will compress the nerve. It can give sciatica kind. That is why sciatica pain, you see, and the pain travels to the leg also. Yes, pinching pain, numbness can come because nerve is compressed nerve. Pinching pain. So, how do you feel when you have toothache? How this toothache is coming? It is coming from nerve. Yes. So, when nerve is inflamed, when nerve is compressed, degenerated, then this kind of pain is coming. And that is why in sciatica, we need to treat lumbar, and we need to treat, and if we have medical report, accordingly, we can go to that vertebra area, and we need to treat leg also. Again, this is posture. Yes. So you have to use good, correct chairs. You are already investing money on so many things. So better use perfect chair if your work is most of the time you're working on laptop. Yes, you have to choose that chair which gives good posture to your spine. This is very important. Again, I wanted to show this chair that how your body is aligned. Very nice posture you can see. Because you see, if disc is degenerated, it does not repair like skin. Yes. So, uh, this situation can improve with movement and support. Support, you see, this person is sitting on the chair with a good support. See the chair, how chair is designed. Yes. And if your job is like this, then you have to select the best chair, best table. Correct. It doesn't mean that costly, but correct table and correct chair. And sometimes pain is coming from kidneys. Yes, you can see kidney location, the two sides of the body. Yes. So sometimes pain is coming from kidney area. And then back pain is not on the central line exactly. Yes, it can come to central line also. Not exact central line, but it can move in a horizontal way, like complete back. If you feel that your backache is um, going towards left and right, you can focus kidney organ and also you can focus UB meridian. As per your Chinese UV meridian, you know how UV meridian is moving, and this is the place where UV meridian is also moving. Okay, so you can pay as an organ, you can pay attention to kidney organ, and as a meridian, you can focus on UV meridian. So back pain can come from many reasons. This is also one reason, that kidney stones, infection, osteoporosis, bone weakening, spine infections or inflammation, and ankylosing spondylitis. This is like in 6K we say this is uh, degeneration is dryness and inflammation is heat, like this. So multiple, when pain becomes stubborn, it means multiple causes are involved. So we cannot address root cause until we have medical good history. Yes, we have medical reports. And painkillers are temporary. It is not permanent solution. Then it is coming back again. Now, very important thing is that, of course, we are healers. If you are a senior healer, maybe you don't need doctor. If you have good knowledge of sujuk and other therapies, yes, maybe you don't need doctor for your patient or for yourself. But if you are starter, beginner, then it is very important that in case you see your patient is suffering from severe pain, and this pain is persistent, not leaving, just with painkillers you are managing, and 2 3 weeks it continues, then you need to show to the doctor, because we need to know the reason. And along with that, you feel numbness or weakness in legs and loss of bladder bowel control, pain after injury or fall. Okay, so take doctor's advice and then we can add our treatment. We need to know the cause. We need medical checkups. So, uh, spine backache is not just spine treatment. We have to understand related organ also. That is why 5-step treatment, we focus all these territories, related organ. So we have, when we give treatment to spine, yes, along with that, we have to understand the organ, which organ is, because each organ is radiating some of the other energy. Yes, and this body, all organs are working as a team. Yes, it is interlinked. Some organs are directly helping. Yes, some organs are indirectly helping. So, in this back pain, which organ can help directly? If we can treat that organ and we can focus in sujok, you will recover very fast. And lifestyle, as it is, I have already discussed. And so, according to level one, let me correct this. Uh, we'll talk about we'll talk first correspondence. Spine correspondence treatment you will do. We have basic system, we have insect system, we have mini system. Yes. So this basic insect mini system itself is so powerful. If you can reach the correct point, you can bring comfort immediately. And we have Meridian Sujoki also. So along with spine treatment, yes, which organ you will treat? As I told you that you have to choose connected organ, as you can see in slide. This back pain is connected with few internal organ energy like kidney. Now, kidney location is on the back side. At the same time, when we talk about our Sujok science and also in Chinese medicine, bones, yes, and spine weakness, bone is coldness energy. Yes. So kidney is the coldness organ, and kidney organ, if kidneys are healthy, then it will support spine. Yes, it will strengthen bone because bones are controlled by kidney. This is coldness organ, water element. So along with your spine points, you treat kidney organ and especially lower back pain. Then liver. It looks very odd that why? What is the use of liver? Liver is here on the right side in the abdomen front side and spine is back. But in our body, all muscles, yes, whether it is internal muscle or external, because inside body also, yes, our internal organ also has muscles. So liver is the storehouse. Liver is releasing wind energy, liver organ. And we have actually in our advanced Sujok, we talk about type 1 and type 2 classification. Yes, lung is also radiating, releasing wind energy in some situation. But for beginners, because I'm talking from beginners point of view, you can take liver and also you can attend a lung, both organs, because lung is giving oxygen also at the same time, wind also. So, because these organs will strengthen the muscles and tendons. Yes. So it will, when you treat liver, don't think that this is organ. Just understand that you are strengthening the muscles. Yes. So muscles in that and in Sujok we have a concept. When you treat spine, yes, and after like whatever is your main treatment. Yes, like when you make 5-step treatment, you keep one organ on the top, like crown. Yes, so this decides that your focus is this. Then you treat a related organ also. Yes, you make like this. This is how you treat according to level 1. So when you treat spine, you have already done, let's say, you have done main system, spine point, lumbar point, insect system, mini system. Uh, when you started your treatment, you started with lumbar spine points. Okay. And after that, when you do liver, kidney, yes, your body understands because you have already done spine treatment. Your spine energy is activated. That room is opened. That place is opened metaphysically. So after that, when you do liver, when you do muscle, when you're doing liver treatment, it means you are strengthening muscles. So your body understand, your spine understand that this treatment is for me. This is the intelligence of our body. That is why I always say that keep your focus on your target organ. Don't just uh, do multiple treatment at a time, because focus is very important. So first organ is spine, and then you do related organ treatment. Your spine will understand, your body will understand that you are supporting spine. You are using these organs, you are doing treatment of these organs to support the spine. So you will experience with the lumbar. Have you ever experienced? Yes. Have you ever tried? Yes. Doing spine treatment and then adding liver treatment. Generally, we do spine treatment, cervical treatment, and we finish. But now give treatment to kidney organ and liver organ. You will see big difference in your treatment. Okay, so it will reduce tightness, it will reduce spasm, it will give strength to muscles in nearby spine area. Yes, and um, sometimes you can do spine and gallbladder meridian tonification or sedation. If you know level 2, spine makes connection with the gallbladder meridian, and gallbladder is also related to, you know, wind energy. Liver is mostly for muscles, and gallbladder is for joints. Yes. So to strengthen the joints of spine, this liver meridian, gallbladder meridian and spinal cord meridian tonification together is also very good. So this is, now in Sujo, where is the point? We'll go step by step. One is this, and then I'll show you on my hand. So this is the model of skeleton. Hand is similar to human body. That is why I told you to see 11th March recording and 12th March recording, because I have explained already that how hand is similar to human body, and we can straight away come to our points. Yes, if you have seen those recordings, then you will understand this lesson, and if you have not seen, still those links are there in the group. Please find time to see, and you will understand that how hand is similar to human body, and then why we are seeing these points on the back side. It is very important to understand that what we are doing, why we are doing. Yeah. So it gives confidence, and your accuracy is maintained because we need accurate treatment. So this is how we see spine. Yes, on the back side, this is nail side, and you can see the arrows, cervical section of vertebra column, and 1 to 8 thoracic vertebra, and 9 to 12 thoracic vertebra, and this is lumbar section of vertebral column. This is the place where we have to do treatment. Sometimes, directly on the spine region, we can do colors. I do colors sometimes directly on this region. Let's say, this is disc bulging in this area, lumbar area. Then in 6 key, we do humidity sedation and wind tonification like this, or dryness sedation, heat tonification. If it is inflammation, heat sedation, dryness color. Yes, but this color you use if you have 6 key consciousness, but for beginners, uh, this is the area where you will do stimulation and you will attach seeds or magnets. Yes, then you can see coccyx last. Yes, sacrum and tailbone point. This is a place generally lumbar area. I have highlighted this because this place is cervical and lumbar is the place which suffers more. Yes, maximum people will come with this problem. So this is the place. So when you hold patient hand, you should know where is the lumbar point and where is the cervical point. This is the back side of thumb, lower phalange. Central line is cervical area, and this is lumbar point, lumbar area. Yes. Uh, in lumbar, this area, we can, I like to do if it is very serious pain, better to do on both hand. In one hand, you can do dry piece application in lumbar area, and in the other hand, you can do fresh piece, because this fresh piece is soft piece. It will not create pressure, but it will release healthy, rejuvenating energy, green, healthy peace. Yes. So this is for energy purpose. And dry piece is for acupressure purpose because dry piece, this piece is hard and dense and it goes easily inside the web. Yes, because middle two fingers are legs. And when you go up, this is central line. You can find the depression, you can find the hollow part between two bones. So that is the place where we fix these seats. Yes, and then we need to press. I'll guide you how to do practical. And in foot, this is the place you can see same area, lumbar area. Yes, you can see center part, massage, and you can do seat therapy here. Tailbone pain here. If it is inflammation, then in this place you can do for a few seconds, you can do ice massage on one hand and you can apply dark blue color. And on the other hand, you can do massage and then attach star magnet or seeds. This is the place for tailbone pain. Kidney points are very important. It is easy to fix on the hand because we have a web here so that kidney seat can you can fix easily inside that follow part. I'll fix and show. Foot you can stimulate, but application of kidney beans you can do on the hand. As I told you, you see, don't underestimate this point. This is not just organ. Kidney organ, of course, is very special, but each organ has particular energy. Each organ is related to some of the other energy. So kidney is related to coldness energy, and to have firm, sturdy skeleton, we need coldness energy. Yes. For having good bones, we need to have harmonious coldness energy. Harmonious. Yes. So when you attach kidney beans on the kidney points, it is strengthening kidney organ and also it is strengthening your bones. Okay, this is the slide. I just wanted to show that here you have to treat brain point, very easily. So this hand is for, head region. Along with that, spine treatment will do brain point. And this is the place of liver. Yes, as I told you that you have to pay attention to liver. Liver is very important. And you can see gallbladder also. Yes, liver, gallbladder, point. Finger system, where is liver point? Where is spine point? You can see. Remove this. So spine, each finger is holding information of full body. And when person is having stubborn spine pain, it is very good to check all the fingers with the probe. Check all the fingers, all the points of lumbar or thoracic, wherever person is having the problem. Yes, so this is the picture. Because there is scribbling, so I'll share again. Wait, share again. Okay, so you can keep this picture in your record. Already you have it. And so this is lumbar region, lower area. And here in this finger, you can see how seeds are placed in a chain. Yes. Backside, yang side of finger, you cannot use big seeds, round seeds, because it is yang surface, bony surface, and seeds will roll down and it will shift from the main point. It is good to use flat seed like making chain of fenugreek seeds after stimulation. Stimulation is very important, very, very important. Yes, just doing random seed therapy will not give any result. Always I say do ring massage. First, ring massage every day on all fingers. And second thing is extra VIP attention to the disease correspondence area. So after doing ring massage on all the fingers, now you massage in insect system and finger system, all lower part. If person is having lumbar problem, then ring massage in that area, all finger lower part area. You can see in the picture lumbar is written, that area you should stimulate with the ring. Now I want to add, before I show on my hand, I want to add very special point, very special point. So this is like Dr. Wall's nerve degeneration, ND meridian. This is nerve degeneration meridian. And this meridian you can use especially when nerve compression or degeneration is involved. Yes, so this is nerve related meridian. When you see this kind of case where nerve compression, sciatica pain, disc pressing nerve, numbness, tingling, weak nerve conduction. So, in this situation, you can use this ND meridian points. And also when pain is radiating towards the leg, back and leg. Yes, tingling, numbness. If you're diagnosed with slip disc and nerve compression in medical history, chronic nerve weakness. When you observe these points, you see, I like these points because especially these points are located on the hand. Yes, foot, all points. Hand is a vast, hand is holding very deep information, vast information of healing world, especially hand and foot. Yes, so the points which are coming in the territory of hand and foot are all good points. So when you see this meridian, you see this meridian is hugging the bone side line. Yes, it is just touching the bone. So this point is not on the surface of the skin. Yes, but in hand you see little far from the skin. Yes, but when you do on the real hand, yes, you can touch this point immediately as soon as you touch this point with the probe. Accuracy is very important. You can save this picture. Accuracy is very important. You have to stimulate correct point. Now, which point? Because we have ND1, ND1A, ND1B. Yes, we have master point like this. We have ND1C. So all these points you can in nerve degeneration, like you can check all the points and whichever point is painful, though we have a very specific point, but you can check all the point in nerve related diseases, and whichever point is sensitive, you can treat that point. Make sure that you don't press very deep, because picture shows this point is deep, but deep pressure is not required. If you do deep pressure, you will miss the correct point. You will not come to know the correct point. Yes, the because pain is coming from deep pressure, not from the original disease point. So don't press very deep. And now I want to tell, like, in if it is really nerve related disease in your spine, ND1, you can see in the picture, this is top of index finger. Yes. So you can use your fingertip to press this point. Sometimes fingertip, yes. This area you can use you can massage or press with the fingertip. Then ND1A, yes, already labeling is done. And ND1B, yes, and ND1C. This is along finger joints. You can see. So try to find the joint first and then up and down, up and down. Yes, check, find the joint, top joint, and then the center joint, and then check up and down, up and down. ND2 is base of index finger. You see, base of finger, that broad part of the bone. So try to feel the point attached with this bone and massage. Yes, this point. And ND3, just go in the center part of your hand where you have long bones, ND3, and you can find in the central part of this attached with the bone. Yes. So control master point is ND3A, chronic nerve degeneration. You can use this point, uh, ND3 and ND4. Yes, near the wrist, ND4. Yes, towards the wrist, or you can say. Now, how to do it practically? I have written so that you do it practically. Yes, important points I have written on the slide. Yes, my ultimate purpose is that you do it correctly for good result. So you have to press ND point one by one. Yes, you can see all multiple points, and you need to find the painful point. Painful point means active point, hard, sensitive, and sharp pain. If you find this kind of sensitivity and sharp pain, but as I told you, if you press deep, then all points will show sharp pain. Okay, you will miss the correct point. You have to press more than moderate, but not very deep. And after checking all the points, you can find the most painful point, but you should add, along with that, you should add ND2, ND3 point if this person is having sciatica. Now, manual pressure you can give, yes, sometimes just thumb tip or finger index finger tip, 30 to 60 second per point if you're checking all the point. Yes, not jumping quickly from one point to the second point. So generally, it is like a special electro tool is used to stimulate these points, but we are beginners, so we can just use uh, fingertips, manual massage. We can do seeds like this and magnets also. So 30 to 60 seconds per point, and you repeat 2-3 rounds. Press and then repeat, press and then repeat like this. So this check, oh, this entire meridian, you see, all points, whatever you see on this slide, check. Then on this point, as per the finger, like if finger is, hand is small, finger is thin, sleek, As per the structure of the hand, you can use methi, fenugreek seed, black pepper. Yes. And with the help of paper tape, you can fix the seed on the point. You need accuracy, stimulate that point. You can make mark. And actually, to feel this point, first you try to feel manually with your fingers. Feel it, feel the bone. Now, also, if you are having pain and you are checking all the points, maybe you feel relaxed, maybe your pain go. You never know while listening this lecture and you're looking the slide, you have points in front of you and you're checking, you're pressing. You never know. You will get relief when you're pressing the point. Yes. So when you fix seed, after fixing the seed or magnet, you should keep for 6 to 8 hours. Now, before fixing the seed, you can do moxa only if person is having stiffness, spasm like of pain, and this nerve compression is not new. It is like habitual. From time to time, it comes and goes, very chronic, and you're experiencing since long. Yes, so all these chronic cases, you can use moxa on this point. It is very effective. Now, not only on this point, but also in Sujok, correspondence area, basic system, insect system, and mini system. And then after doing moxa, then you do seeds. Okay. So also, for nerve compression, here is a chain. If you want to follow chain ND1, ND1A, one by one, ND1A, B, C, then ND2, ND3, ND3A, ND4. Like, yes, this chain, if you can maintain, check one by one. To remember one thing, in picture it looks deep, but these are not deep tissue points. Yes, when you hold hand in reality, they are surface level and these points are very sensitive. So if you press very hard, you will miss these sensitive points because when you press very hard, this point will lose its sensitivity. It will give pain, just pain, sharp pain because of pressing, not that pain sense highly sensitive point. Even with the uh, moderate pressure, you will get to know this point. So you need moderate pressure to feel tender point. These in nerve degeneration, whenever there is nerve related problem, it's not about spine but other things also, and it doesn't matter. uh, it is automatically solved. So moderate pressure is enough to feel slight tenderness. You have to identify active painful point. This is very important. Now, whenever you are treating this ND meridian, treat both sides. Focus more on affected side. If pain is radiating towards left side, then you give more attention to the left side. If both side, then you treat both. But in any case, whether it is left or right, treat both side points. Correct point, correct stimulation, better result than strong pressure. This is rule for Sujok also. Yes, we give strong pressure and patient jumps. When patient jumps, therapists become very happy. Oh, I reached the correct point. Oh, I reached that sharp, painful point. Madam told us in the class, you have to find sharp, strange pain point. And you give strange pain with your deep pressure. Yes, so you have to understand the technique as a healer. Pressing is a very good, this is very good art, how to find the painful point. If you press deep, all points will become painful. If you press less, then you will not find. So it you have to keep more than moderate, little bit gentle to moderate, or more than moderate, but not creating blue mark, not damaging the skin. To that extent, you have to keep this extent, this border in your mind. Okay. Now, you can combine ND points with Sujok, but not same day. Okay. Like sometimes you will see that mini system and sex system, in my experience, spine treatment, most of spine cases, yes, most of spine cases out of 10, 8 people, they get experience good result with simple basic insect system, mini system. Yes, but if you feel really chronic nerve degeneration, this is additional point you can do. But uh, when you're doing ND point, stay with ND point, and in that day, don't do so joke. As I always say, that don't create traffic on patient hand. Okay, so you can do like this, like one day, let us do it spine or correspondent point, spine point, kidney point, liver point, brain point. Here, brain spelling you can ignore. PRAIN, just wrong typing. So, whenever you find point, whether it is Sujoke or ND meridian point, yes, hold probe in a vertical direction and give pressure. Uh, More than gentle, I will say, gentle to moderate actually. And stay there, even in Sujoke. Once you first is finding the point, after finding the point, stay there, stop there, and with the same pressure, stay there for 5 to 10 seconds. Check sensitivity and then stimulate for 30 to 60 seconds. Stay there and then stimulate. Repeat 2, 3 times. If person is having acute back pain, you should stimulate 2 times daily. 2 times. Stimulate. You can, like morning you did it. You did stimulation and seeds. Then after 6 hours, you can remove, you can give rest to your skin, and before sleeping, evening, you can do it again if it is acute pain. Chronic pain once in a day is okay, but I always say that because patient is always asking how many days. 2 weeks, you can say. Start with 2 weeks. You never know. Day one is okay. Maybe first day, problem solved. Yes. And but you always say 2 weeks. In 2 weeks, you'll be able to show many good result, not only on spine level, but also mind level, body level, other organ level also. Yes. So it is very good idea because in this 2 weeks, you will do energy points also. Yes, you are because you have made a very good package. You have made a package of 5 step treatment. You have made a package of organs, main system, insect system, mini system, and each day is precious for you. If you're dedicating your time to mini system, make sure that you check all mini system points today. In all fingers, we have mini system. In toes also we have mini system. Check one by one with patience. With patience. Sometimes without fixing seat, you will see pain gone. This is power of Sujuk mini system. Yes, insect system. Mini system you can try. Basic system is very good. Actually, make a habit that basic system you will find one spine point, lumbar area is one, insect system, many insect system in one hand. So you can check which finger is having pain, and mini system also you have in all fingers. So with probe you can check. If you invest your time, then less sitting, but if you do it random treatment, maybe you need to do for 1 month, 2 months, 4 months. Instead of doing random treatment for so many days, better to do quality treatment so that you can produce result in one day, second day, 2 days, 3 days, 4 days, like this, as soon as possible. Now, I want to show for beginners actually how to stimulate. I'll change my camera, share my screen. After today's session, I really want you to take action so that you don't suffer. Yes, painkillers are temporary, giving temporary relief.
Ma'am, move your laptop a bit because you're going into the corner, and when you start explaining, you won't be in this screen.
Uh, you can see my video now. Tell me, you want me to move my laptop? What did you
Yes, ma'am.
say?
Yes, ma'am. You're in the corner, right? When you start showing in the other screen, you won't be visible in here.
I know. Why? Because my this camera is here in this direction.
Okay, fine.
Okay.
Yes, ma'am.
So my hand is important in this present moment. But still,
Sure.
I will try. If you
Yes,
can
ma'am.
see my face, let me adjust. Because I'm using, see, this kind of camera.
Got it.
I
Okay.
have a camera, but it is here, not in front of my laptop. So let me adjust a little bit. Now
Yes, ma'am. It's good.
shifted my camera a little bit. Okay, so now I use this pen to mark points on my hand, and then I need a probe. I need inserter, and then I need magnets, and I need this. Like this, you need to prepare. So these are fenugreek seeds I like to use on the yang surface. Magnets, yes. So first of all, and we need paper tape. These tools you should have. Okay, this is paper tape cutter. Now, first step is it is very simple, and I always tell you, but I don't mind repeating because action plan is first is ring massage. Yes. So ring massage, like spine coins in insect system, this is cervical. Yes. And when I talk about back pain, then lumbar is focused more. Yes. So this area, you see, when you divide this phalange into half, this line, central line, this is all points related to low backache. Half this phalange you can see, and then half. So this area is related to your low backache. So maximum problem is coming from this area, low backache. So in this hand also the same thing, and in foot, yes, in foot, and in basic system, this is your low back area. This part is lumbar, and this is sacrum and tailbone region. Hmm. And in foot, middle two toes are your legs, and this area is low back ache area. This area, okay. And in insect system of toes, this is the place. Base, find the base and central line. This is right foot, and same thing on left foot. Okay, so now we have main system point, insect system point, and then we have mini system. Mini system here, uh, touching the nail central line, touching the nail central line. And here, because this is foot correspondence, line is little uh, away from the central point, but as a beginner, you can take central point and then you can check nearby area also. Yes, low backache point. And all these dots I'm removing. This was cervical area. Clean this cervical points because now we are focusing spine point. So this is mini system. Now, what you can do first, you have to be very clear with your, areas. So that when you pick up probe, you know that after this, I have to go to this, next, 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 in a very rhythmic way, not a jerky way. So this area is with here you can do manual massage. Yes, two legs and exact center line. You can do with the tip, cut your nail, and you can now massage nicely. Yes. After massaging, here you can use now. These are soya bean seeds. Actually, I like this also. You can use dry piece. There is a difference, you see. This is the dry piece, and this is little oval shape. You can see the eye of this seed, soya bean, white, not lobia. Yes. So white beans you can use. I like this because it goes in that hollow part. But also you can use this. Sometimes I like to change seeds also because each seed has its own energy. Peace will have its energy and this will have its own energy. So if you're treating like today this, tomorrow you can treat with this seed. So let's take this, for example, peace seed. And this is also art, how to do it. I like to use first and then I'll overlap with big tape. Try equal size seeds. Now I'm doing it randomly to save time. But when you do it, make sure that you choose equal size seeds, equal size. So this is the place. Yes. And then you can overlap. There are many ways to do it. Many people, they directly do it on broad tape. You can do this way also. Yes, directly you can do it. If this tape is not staying well on your skin, you can give extra support like this. Yes. Now I'm removing. And then tell your patient to press several times. See, this is very powerful. Don't underestimate the power of this basic system. Hand is similar to human body. Please don't forget this sentence. When you're doing this application, your real lumbar, your spine is receiving the message, the vibration. And I told you that energy should move. Movement, if lack of movement, then this spine will take degenerative, will go towards degeneration. So when you're doing this, you are moving the energy in your spine. Yes, sometimes um when you hit correct point, then it releases curative waves. But sometimes when you're doing extra additional points, even though it is not on the painful point, but at least it is helping the energy to move. Yes. And for perfect healing, we need accurate point. Okay. And now with this, I want to tell tailbone, if pain is really in the lower area, sacrum area or coccyx tailbone area, then we have a different technique of paper tape. See, you can take, actually, you can choose magnet, you can choose seed, but when we are choosing magnet and seed, it should stay well. It should, because it is in the web, tailbone is here. Yes, it should not roll down. So star magnet also we have different size. You can choose little bigger size also. It depends, big hand or small hand. Now point is just one tailbone, but I am making little long chain and you see how I do it. It's like, hook, creating a hook like this. Hook. So, see, taking U shape, extreme low backache, reaching tailbone. So, it's like I created U shape. Yes. And now I can support using this broad tape. All this is art. If you do it correct point and then how to fix it, this will come with practice, but now you do it as I'm showing. And some people, they are using different technique, different style pattern. Point will not change, but how to use, how to fix paper tape, that can, change. So this is how I did it, my tailbone. And now, like insect system, when you do insect system, it is very important because we have many insect system. Yes. So first is ring massage. You guide your patient to do give more attention in this area. Yes, more attention on this area. So now with probe, you're checking all the point one by one, one by one. Idea is not jumping quickly, otherwise you will miss patient response. You will miss that tender point because you are jumping so fast. As a result, that point was about to show its sensitivity, but you jumped so fast. As a result, you missed the correct point. Okay. So now we don't have time to check all points, but please try to understand. So after checking, let's say, start with this index finger, hetero finger, always. Okay. You can do here also, but this is good. So little more than moderate checking with patience. And when I'm checking, I know the depth. I know that, oh, I am hitting the bone. And if you hit bone little deeply, oh, this bone will give sharp pain. Then this pain is coming from bone, but not from the point. So you should know the difference between the point and the bone. Pressing bone will give pain to all. Yeah. So that is why please understand and explain to your patient. So normal pain coming from bone is okay. When I'm doing more than moderate and checking, this is normal pain. Yes. So I'm not pressing deep, but if I get pain here, I will stop. And now I bring my patient here. While when checking, I was doing vertical. Once I know, I'll mark with pen, I can mark and then creating vibration on this point. Yes, like this, moving or press, release, press for few seconds, press, stay, and release. Then press, stay, and release. This technique you will do on all painful points. You can get 2 points, 3 points, 1 point. Same technique is with the toe. If person is having really serious problem, then do this effort seriously, and first day patient will show the result. He'll say big thanks to you. So this is little dedication and time consuming, but last end result will be very good, happy result. Yes. So I told you that instead of doing many days, do quality treatment. Yes. So this is how you checked it. Here also you can fix the seed. Here you can make like in toes, you can make chain of fenugreek seed. Toes are small in size, small in size. So two seeds or three seeds you can attach like this. Yes. You can attach and roll down. And in finger, star magnet or fenugreek seeds, because round seed will roll down. This is bony area. Yes, make a chain. Yes, like this. And then press nicely before you leave patient hand for 1 minute press, and then tell your patient to press from time to time. This is how you do it on insect system. After checking all insect system point, for example, you've found the pain here, you have done here. If you find two areas, you do it on two fingers. Same way, this is mini system. Checking all the points in mini system one by one, one by one, one by one. Let's say this time this finger is showing pain. So here also fenugreek seed will help. Correspondent treatment is very powerful. In 6K also we can do it. With Triurgen also we can do it, but 6K and Triurgen needs special consciousness. Here you don't need special consciousness. You should know the correct point and the technique how to stimulate an artistic work of attaching seeds to the point. This is mini system. So let's say one basic system, one insect system, one mini system. Always, whenever person is having problem in Sujok, one work on basic system and one application on insect system. You can check all fingers. If you find one finger is showing pain, one insect, two, then choose two. But idea is to give attention to basic system, insect system, and mini system. So this is how you did it. Yes. And I told you that it is not necessary. Like I told you that you have to do it liver point for strengthening the muscles. You have to do kidney points. Yes, for bone strengthening, and also yeah, kidney is related to bones, and location is also there. It can give pain. Now, if you have done this, yes, and if you say that many painful point are there in two fingers and a mini system in one finger, basic system, don't do more treatment. Don't create traffic. Yes. A second day you can do it. One spine treatment you have to do it every day because it is the major highlight. Yes, but instead of doing on all fingers, you can do on one finger insect or mini, because today is the day for, let's say today I'll do kidney and liver. Liver, why liver? Not because liver has problem, but you want to release um, energy for muscles. We want uh, good energy for muscles, that spine area muscles, And liver can give you this energy. So you have to open this storehouse where this wind energy and energy for muscle is preserved. So we need to open that. So where is the liver? Please do liver points for sure. So like in basic system, this is liver here in this area, general idea. Yes. And here you see this place is liver. All fingers same design. This is liver. And in this place also liver. I'm just roughly marking, not accurate liver shape, but just to give this, I'm doing with left hand. But just to give you an idea, this is liver area. And today my task is liver and kidney. Okay, and in mini system, this is liver. This is liver. This area. Okay, so I have basic system liver. I have insect system liver. And if you see mini system liver, insect system and mini system liver are opposite actually. Okay, so insect system liver is here. If I'm talking to beginners because they don't have idea why liver is here, why mini system liver is here. So I'm just giving you simple take. These are the liver points. Okay, you don't need special consciousness. You just need to know the point and stimulate. And with the probe, with same technique, you will stimulate. Yes, you will stimulate. And after checking all, let's say this is painful and this is painful, then you can take, I like green lentil seeds for liver, green, this one, this seed. You can see seed, green, and eye of the seed will touch the skin. So you can take 4 seeds, triargent model order says 4, and all 4 seeds together. White dot of this seed or eye of the seed will touch the skin like this. And wherever you have touched, you can take, according to the size of the finger, you can add more seeds also. Yes, like this needs 2 more, you can add. And sometimes you can do like you can change seeds. Like today you did green lentil, tomorrow you can do fenugreek also, then you can do star magnets also. Yes, keep changing because uh, each tool will have its own energy, and God's energy is available in everywhere, everything. Yes. So if we combine multiple things, we'll be able to touch good quality and quantity of God's energy. Though it is infinite, we cannot compile. But yes, I like to use with this mission. Sometimes I like to take energy from green lentil. Sometimes I like to use fenugreek seed. Yes, sometimes star magnet on liver point. See, our mission is to cure. This patient is suffering since long spine pain, my God. And every time pain comes back. So let us do dedicated treatment for 2 weeks. If a patient says like first day, oh, my pain gone, still you do for 2 weeks. Okay, so this is how you have to strengthen liver. And to strengthen liver, you can do green line also. In this middle finger, this is exact center. Start from here and do green line here and do green line here like this. Okay, so liver point, and you can check all, and you can then the skin doesn't come. So though if your pressure is very deep, then you will see blue mark on the skin. Yes, it is an indication that your pressure was deep, and then next time you take care. but sometimes you see mark after pressing. You can see mark, but you don't need to worry that mark will go quickly. Okay, so it's okay. Sometimes this probe is metal, it leaves the mark also. So don't worry. Sometimes it leaves black mark. So this is, and when you wash your hand with soap, that mark will go. So this metal can also leave mark. So don't worry. Now, kidney beans, I like to do it for or backache problem. Yes, kidney beans size and kidney bean shape matches with real kidney. So this is the place I'll mark for you first. General idea. Yes, see, this is skin crease. I'm giving a general idea. This is not accuracy, but for beginners. Yes, I'm not giving big frame. Yes, this web, you can feel web here. So, and then you can feel the depression here between two bones here. Two bones, there is a depression. My, I'm placing like this, see? Without paper tape, I'll show you. White dot, two white dot will face each other like this. Like this. This is my aim. And then with paper tape, so I like to do one by one. Yes, preparing my hand. And then slowly, first, I take the position. When I feel that I did it correctly, then I will stick tape. Yes. And if you want to give little bit support like this, and this will stay for many hours like this. Sometimes you don't need this support, not necessary. This is not necessary. I see hand, how people working hand, if the hands are moving a lot because of their some work, so I do additional support. So this is like I did liver point. Then, this is brain point. Brain point also better to check all points. Yes, check, and wherever pituitary gland is there for sure. But then you can check also. Now I want to focus one thing, like if person is having acute pain now. Yes, pain management. You can say pain management. So let's say uh we'll make use of this bar magnet. If person is having acute pain, you can try this technique. This is called meridian Sujoki. Yes. Choose index finger. If pain is radiating more towards the left, you can go to left hand first. If pain is radiating towards the right, you can go to right. Mhm. And if pain is in the center, exact center, then for male, you choose left hand as first choice. For female, you choose right hand for as first choice. So in pain management, if pain is later, you can do that in painful point. But initially, you can do like this. Pain. Yes, sharp pain. Yellow facing the nail. Yes, this mark. This is called, because in level 2 we study spinal cord meridian is here. So this is called spinal cord meridian sedation. Hmm. And we can keep this magnet for a minute and check if pain is reduced. It is good. Yes. And if it is not showing any sign, then you can check second finger. This is also second spinal cord meridian, like this. Yes. But if you feel that left hand is showing some result, you can use this. And at the same time, if pain, you don't feel change, or you feel that pain is continuing and is going towards higher side, then you can also reverse the magnet and check like this. Okay. Generally, we start with sedation. This is sedation. At least you can do it like this. Sedation. And if patient says that my pain is now 50 percentage, yes, reduced, then you can put second magnet in the middle finger central line. Now see here, your yellow is towards the nail. Keep same color. So this is color symbol I'm giving to beginner, but in our meridian, so jo people, students, they know that we have to do opposite, and actually we have done opposite. This is sedation and this is tonification, and this is how we do algorithm. Yes, but for beginners, I am giving color symbols. Start with the yellow facing the nail because they don't know energy flow, they don't know the gate, they don't know long wheel concept. So to make easy, you start with this pain management, spine, lumbar paining a lot now. I have told you the hand, left hand or right hand. Yes, female can start with the right hand. And if no result, you can do with the left hand. Male can start with the left hand. Whatever technique you're learning on the left hand, you can do it on the right hand also. So you do this first, yes, and wait for few seconds or a minute. If pain is reduced, but not fully reduced, then you put second magnet here, like this. Same, you see, second magnet, yellow color in both finger, yellow color facing the nail. But when you put second color, then you keep your awareness here. If patient says, wow, my pain is reduced more, I'm feeling better and better. Yes, then you can keep these two magnets for 15 minutes, 20 minutes. Sometimes after 5 minutes, patient can say, oh, my pain is completely gone. Then you can remove this magnet immediately. Sometimes in 1 minute, patient can report my pain is gone, you can remove. But when if patient says that with this application, my pain, I feel that it is returning back to the same pain condition. Idea is this game says reverse the magnet. So if you see the symptom is giving discomfort, you can reverse the magnet. Opposite, you see, it is opposite now. When you see this, it is opposite of this. So this game you can play, and it is not difficult. But when you are doing this, don't do correspondent treatment. After finishing this, you do correspondent treatment. Okay, so this is how there are many ways to attend Meridian Sujoki, but again, I am telling from a beginner's point of view. Okay, sometimes you can just do with one magnet also, no problem. If you have understood this first, this is in our science, Meridian Sujoki, exact central line of index finger is spine meridian, we say spinal cord meridian. So this is called sedation. Okay, and then you can remove. Be careful. Don't leave this magnet for uh, many hours, maximum 2 hours, minimum 1 second, sometimes 1 minute also. As soon as patient pain is relieved, remove it. But correspondent treatment you can keep for 6 hours, 8 hours, 10 hours, no problem. Okay, and also don't keep this magnet during night time and sleeping time because this is very powerful magnet. If patient catches this energy, patient responds to this. Some people respond very easily and quickly. In 1 minute, pain is solved. Okay, one is this thing. Then we have, of course, six key also. Yes, in six key, if there is degeneration, we have renting technique. Yes, we have simple local six key also. But here, from Ignis point of view, exact if spine, chronic spine pain, and degeneration is there. Yes, you can put orange line on this central line. This is spine meridian for 2 hours in daytime. Orange line here and orange line here in case of degeneration and chronic problem. Moxa, moxa here also in basic system. Okay. All insect system, you know what is moxa. You do moxa here. Okay. And uh, in triorigin, yes, in triorigin, uh, this joint, especially right hand, not left hand. Now, in this thumb, see, you can put one dot here. See my line here. My line is finishing here on the yin yang line. Wherever this baseline is finishing, put one red dot here. And then focus on this joint. If there is new problem of spine, acute problem, inflammation, then on this joint you make a blue ring. Yes, along with your correspondent treatment, you can make a blue ring. This is like acute pain, aggressive pain, acute pain. In Trajan, we have a unique technique, but then I'm simplifying and telling you. And but if inflammation, chronic pain, spasm, dryness symptoms, yes, stiffness of spine, then you have to put red color. Stiffness of spine, spasm, yes, chronic pain, dull pain, and regular pains, months and months come and back. It is persistent and comes back again, then it means this is very strong homophos. You should put red color on this joint. Blue color only in that case when there is inflammation and sudden pain, acute pain, new pain. Yes, some inflammation is there. Then you can put blue color. And in 6 key, this is fine actually. Uh, I'm telling you simple 6 key. If you're putting colors, then this is dryness below the nail. Just leave one point. This is coldness point, and here is this is dryness point. Red color here, just below the nail, but just leave one point space, and then put red color. Yes, and then this is knuckle. Above this is just above this. This is heat point. Two red dots for regeneration, chronic problem. Yes, aiming circulation should start. Dryness, shrinking, that dehydrated disc. You remember that? Yes. So in Triargen, actually, we have a very beautiful way to reach the disc, but we need uh, little more studies to understand that. But you can do this. And then the same point here, the one point below the nail, and this point, and this is the bony part, not here, but above the bone. 4 red dot here. Now, when I compile all, don't do all treatment in one day, and I'll show you just a moment. Please. Don't do all everything in one day because uh, we don't need to create traffic. And also, I wanted to show one more important place. Wait. Um, Let me stop this shading. I will show you one slide. I like this also. This slide. Oh, sorry. Yes. So this arch area. Yes. So actually, when we study different types of correspondence system in Sujok under triorigin, we have close type. Yeah, it's not just, correspondence journey is big journey. In level one, we just study basic system, insect system, mini system, partial system. But in tri-origin correspondence system, this is another territory, yes, where we have closed type, site system, open type like this, different variety of system. So anyway, better we just focus the point. This is the place, you see the arch and the bony area. With thumb, you can massage this area, check with your thumb tip. This is also very sensitive. Try to find the painful point. And now, immediately, you can check now also. Yes, check with the thumb tip and go with this flow with the arch. Try to find the point, and you can attach seed here also. And coloring is also there. And then one more point, this is Li4 in Chinese meridian. Maybe you know this. This is very good. This is between thumb and index finger here. You can see in the web area and touching the bony part here. You see, this is V shape. This is V shape, and we have flesh here. And try to feel this web and reach that bony part where two bones are meeting and creating V shape, and touch that V point, bony point. This is Li4, large intestine meridian 4. Large intestine 4 point. Yes. So you press firmly. Yes, that pain will there, but tolerable pain should be there. And when you press this point, you stay there, fix there, hold for 30, 60 seconds and don't immediately remove. Okay. Hold that point, stay there, and then release. Do it again for 4, 5 times, 5, 6 times. And this is very good point. This is pain relief point, and also it reduces inflammation. Okay, not in that part, but also in other parts. And this point also is very good in addition to other points. So now we have different you know techniques. You can start with simpler techniques, but don't do everything in one day. You can select like ND points one day, you can do it, and those points are very clear when you see that picture. Yes, so you can do it, massage it. Idea is do very nice treatment, make a very nice. Now you know full story. I have selected important points from all the levels. But yes, 6 key triarchon, in triarchon, we can exactly go with the exact vertebra we can go. We can go to like if disc prolapses between L3 and L4, we have a way to reach this area, exact place and mark this. Yes. But this needs, as I told you, good big consciousness of triorigin. And I hope with this techniques, whatever you have learned now, definitely you will experience the result. Hmm? So I hope you have understood and you will take action if you are having pain. Yes. So we
Any
can.
doubts? I don't think so. It's possible. It's already late. So I request you all to please go back to the group and share your queries, okay, in the group and your feedback also. Please.
And when you see the class, maybe your doubts are solved because practical part is more important. Yes. Please practice whatever I have done on my hand, and you will see the change for sure. For sure, I know because I treated with these techniques my patients. Thank you so much for your presence. Thank you so much. And please take action to heal yourself. Bye bye.
My gratitude, ma'am, from this Kerala group and all students. Thank you so much. Uh, dear all, please note that I hope you have made notes. If any queries, as requested, please go back to the group and share your queries. Ma'am will check and answer them whenever she finds time. Thank you so much. Good night, everyone. Smile,
Thank you
gratitude.
so much for your hearts, many hearts coming with
Yeah.
smile.
So great to see your hearts. And I just want to see your words in the groups, please. Please don't go away. Share your words in your group. Wherever you are, in whichever group you are, you please share. Thank you so much for all your love to ma'am. So ending this session with smile good night to you and ma'am also. Smile gratitude, ma'am, from all of us.
Smile, thanks.
Thank you, everyone. Good night. It's already late, so we are ending this session at this moment. Bye, everyone.